I'm waiting for people to get on the live so that we can start. And I'm sorry I'm not in front of a chalkboard today. But this is Dr. Mary from the Remedy Room. I'm an internal medicine physician, and we have an innovative clinic that aims to keep you in optimal health by empowering you with education. So I want to draw your attention today to an article that was in NOLA.com yesterday, and it was about a study that was done at Tulane University, and it was titled "The Syndrome That Seems to Predict a Lethal Outcome." And what I want to focus on today is more ways to help improve your immune system, and that is going to be through prevention. So what we're not talking about, which we've already discussed so many times, we're not talking about ways to keep from getting sick. So let's talk about this syndrome that kills our patients more often and also causes more heart disease and more deaths, and it's called metabolic syndrome. So metabolic syndrome is when you have a medley of the symptoms that we all know are correlated with higher infection rates and death. One is obesity, specifically central obesity around the belly. So that's increased fat around the waist. So for your homework tonight, I want you to go get the measuring tape, and if you're a guy with a waistband over 40, and if you're a woman with a waistband over 35, you fit one of the criteria. The next is elevated blood sugar. You guys will hear about us talking about diabetes, pre-diabetes, and then certainly insulin resistance. And if you check your fasting blood sugar, the conservative world would say under 100 and you're good. Under 100 for glucose for fasting blood sugar. We disagree at the Remedy Room, and here's why. From 85 to 100, I would say 90 to 100, you're actually causing damage to the small vessels. And if the blood sugar is elevated, you're causing that microvascular damage 10 years prior to it getting even higher and higher and developing full-blown diabetes. So getting your blood sugars around 85 to 90 or lower is our goal. Elevated triglycerides. We know that triglycerides are a storage form of sugar and carbs in the liver. And these triglycerides are an easy way for, at least for our staff, we can see what the patient's doing in regards to their carbs and sugar intake. And when the triglycerides are over 100 on your labs, it causes us concern to consider fatty liver. And we've talked about that before, that fatty liver is going to be one of the bigger causes of death in the future from what they call non-alcohol fatty liver disease. And it's something that's totally preventable by cutting back on the sugar. And then the final measurement is low HDL. That's the happy or good cholesterol. And for men, if the level is under 40, and for women, if the level is under 50. So of this criteria, when you have something called metabolic syndrome, that means you have more than one. You actually have 3 out of these 5 criteria. So thick around the waist, high triglycerides, which makes sense if we're having lots of sugar and lots of carbohydrate-laden meals, elevated blood sugar, which that would happen, and then fasting blood sugar we talked about, low HDL, and did I miss one? So low HDL, triglycerides, fasting blood sugar, and fat around the waist. Oh, elevated blood pressure. Missed that one. So that's the 5 criteria. Anyway, the point is that the syndrome that predicts the lethal outcome for this virus patients was 3.5 times more likely to cause death. These guys were in the ICU, intubated, and you can read about this. I'm going to link the study and link the article. But here's the point. We have control over this. I'm not asking you to make any extreme measures, but you need to understand one thing. Every time we eat, whether it's a perfect meal that's full of vegetables or it's something that's not so healthy like fast food, you're calling out insulin. Insulin is a hormone to help us utilize the glucose and the sugar and carbohydrates that we eat. We need it. But when it is out, it is going to keep you from burning fat, and it's also going to help you store more fat. So for your homework, I want you to measure your waist. I want you to get your labs and check your triglycerides and your fasting blood sugar. And obviously you hopefully know what your blood pressure is. And then I want you to start cutting the carbs. The average American eats 200 to 300 grams of carbs a day. And so we'll keep talking about this. We're going to talk about intermittent fasting, but it's just an easy way by just starting to be aware of how many you're eating. And then the final piece is don't eat less, just eat less often. So back to the insulin. Every time we eat, we spike insulin. Every time we think about eating, we actually spike it. But and when we smell that delicious bread or go into a lovely dessert shop. But by reducing the insulin, we're going to reduce the inflammation, and we're going to reduce the majority of these things that can increase our death rate. So if you want to prevent and you want to increase your immune system, let's start by increasing awareness, get your numbers, find out where you are, and then let's start cutting back wherever you can. So measurements tonight, get your labs, and if you're eating a sandwich, take the top off for me. All right, this is Dr. Mary from the Remedy Room, and you can look us up at theremedyroom.com. Share this with someone who you might know who might have metabolic syndrome. And we don't need any labels. We can do something about this, y'all. This is just another way to prevent, but let's start to be aware. Thanks for watching.